So welcome everybody. We're going to go ahead and do a couple housekeeping items still, but I want to start with introducing myself. I'm Ashley Hazeltine. I'm the president for the Greater Derry Londonderry Chamber of Commerce, joined today by the president of the Greater Salem Chamber, Donna Morris, as well as Senator Jane Shaheen. So a couple items before we go ahead and get started. I have gone ahead and muted everybody so that we can streamline the audio for today. We are recording, and a special thank you to Salem Community Television as well as Derry Community Access Media. They are both making this available to all of their viewers as well. We have the group chat available, so we would ask any questions be directed through that chat box, and we will help filter those. We do have some of the senators' staff with us as well today. So we do have a full hour set aside for today. A couple quick housekeeping items as well. If you happen to unmute for some reason or turn your video on, we ask that you just help with keeping yourself muted and the video off to streamline it. We do have a couple members of the media joining us as well, and we do have a request from any members of the media to please contact the senator's staff directly versus using the Zoom chat box, and they are happy to get in touch with you. And a brief reminder as well that this event serves today as the Washington update, with Senator Shaheen being our state's senior senator. It's not meant to be a political event. Both of our chambers are nonpartisan organizations really focused on the issues affecting businesses within our state. So we kindly ask everyone to keep questions and comments around that basis as well. As I said, we are recording the meeting today, so it will be available for future reference for those unable to join us today, or if you do have to depart early. So, and thank you, Senator Shaheen, for taking the time. And with that being said, I'd like to turn it over to Donna.
Thank you, Ashley. Good afternoon, everyone. I'm Donna Morris, president of the Greater Salem Chamber of Commerce. The Greater Salem Chamber is pleased again to partner with Greater Derry Londonderry Chamber to bring you today's Washington update with U.S. Senator Jane Shaheen. Our two chambers often partner to benefit our members, and as Ashley mentioned, we are nonpartisan and non-political, but we do focus on advocacy efforts to make sure elected officials at all levels of government know what issues are important to our members, which is the local business community in our area. Today, we will be focusing our program on issues pertaining to support for businesses during COVID-19, lowering healthcare costs, and lowering tax and regulatory burdens on businesses. A notable victory for our advocacy efforts earlier this year was the repeal of the health insurance tax, the HIT tax. Senator Shaheen and her colleagues on both sides of the aisle heard the chambers and worked with us in a bipartisan fashion, worked in Washington in a bipartisan fashion to repeal this tax on health insurance, and thereby delivering some real relief to those who buy health insurance for their employees. A little bit about Senator Shaheen. Senator Shaheen is New Hampshire's senior U.S. Senator and is serving her second term in the Senate and seeking a third term in November. She served 3 terms as governor of New Hampshire and prior to that as state senator. In the U.S. Senate, she serves on appropriations, armed services, foreign relations, ethics, and small business, those committees. She's also the first woman in U.S. history to be elected both governor and U.S. senator, and that's an impressive and an inspiring accomplishment, Senator. We are pleased to be able to have the senator spend some time with us this afternoon and give us an update on important legislation in Washington and answer some questions from our members. Senator Shaheen, thank you, and please take it away.
Thanks very much, Donna, and thank you especially for that very generous introduction. Thank you to Ashley as well, and to all of the members of the Salem and Derry Londonderry chambers who are joining this afternoon. I wish I could be with you all in person. I always enjoyed being there and interacting one-on-one, but virtual will have to do. And hopefully the next time I see you all, it will be in person. I have spent a lot of time since I got home in August, while the Senate was on recess, traveling around the state. And I can tell you that the 2 biggest concerns I hear from people, and I'm sure you won't be surprised, are the coronavirus, how are we going to put an end to this pandemic, and also the economic fallout that has resulted from that. We have so many people who are still not able to go back to work, a lot of small businesses that are really hurting. As chamber members, you appreciate that, and I know that Donna and Ashley have been dealing with that. So we still have work to do. I'm really pleased that in the early months of the pandemic, back in February and March, the Congress really pulled together in a bipartisan way to pass 3 major packages of legislation very swiftly. The first 2 dealt with trying to respond to the coronavirus, to putting money into testing, into research, and for a vaccine and therapeutics, as well as to try and help with the cost of healthcare and testing for people that didn't have health insurance. Also funding for hospitals and medical providers. And then on March 26th, we passed the CARES Act, which was a major package that deals not just with testing and help for medical providers, healthcare workers in hospitals, long-term care facilities, but also for small businesses. The PPP program was part of that, as you know. Also provided help for expanded unemployment for those people who were losing their jobs, and help for select industries like the aviation industry. There were challenges with, I think, many of the provisions of that legislation, but I think particularly the small business provisions, which I work directly on with Senator Rubio, who's the chair of the Small Business Committee, Senator Collins from Maine, and Senator Cardin from Maryland. The 4 of us helped to design that program, and to date, it has helped over 24,000 businesses in New Hampshire and brought about $2.5 billion into the state. Part of what we were able to do also as part of the CARES Act was to allocate $1.25 billion to the state of New Hampshire. I'm pleased that we were able to get support for state and local governments as part of that package, and it has done a lot to help small businesses as well. With the Main Street program, I know that there was funding allocated to the chambers of commerce. I'm sorry we weren't able to get the chambers included initially in the PPP program, but was pleased that the state was able to include you. So that has been very helpful to state and local governments who have really been on the front lines of dealing with this pandemic. We have a lot more work to do. And as I said, that's what I'm hearing from people as I travel around the state. We need to work on another package of assistance for people. I thought that would have happened before we came home in August. The House passed a bill called the HEROES Act back before Memorial Day. Majority Leader McConnell declined to take that up in the Senate. He finally, at the end of July, proposed a scaled down version that includes some help for businesses, some help for schools, some assistance for people who are for hospitals and medical workers. So it's got some help in it. There's a disagreement at this point about what we're actually going to pass. And as I'm sure you all know, if you've been watching the news, we've been in stalemate in Congress with the administration since the beginning of August. I'm hopeful that when we go back in September, that we'll be able to reach some bipartisan compromise. Now, back when we passed the initial response to the coronavirus, those pieces of legislation all passed virtually unanimously because people understood that we need to respond. And what I'm hearing from New Hampshire is that we still need to respond to concerns that people have. For small businesses, there are a lot of small businesses who got the PPP program who still have not gotten back to where they want to be, and they need some additional help to get through the remainder of the year. So I'm hopeful we can get something done for small businesses. I've heard from hospitals in New Hampshire that are very worried about the financial situation that they're in and have taken out loans through the Centers for Medicaid and Medicare and are worried about how they're going to pay those back. So medical providers who have small practices who still need help. So we still have a lot of work to do. And my goal when I get back to Washington is going to be to focus on doing everything I can to try and get that assistance that people need. So let me stop there, Donna and Ashley, and see, I know people had a lot of questions, so see if I can answer your questions.
Sure. Thank you, Senator. And a quick review, since we had a few people that were able to join us, we are asking anyone with a question for the Senator to please direct it to the group chat within Zoom. Any media questions can be directed directly to the Senator's staff, and both of the Chambers of Commerce are nonpartisan, so our goal today is to keep this on a business-focused conversation, and I'm sure the Senator's staff is happy to answer any questions that might fall outside of that and connect with somebody directly. We do have several staff members available today to be able to help with specific questions and items as well. So would love to lead off, Senator, focusing on the work that you did to repeal the health insurance tax. It's a great example of Congress working together in a bipartisan manner. Do you see Congress coming together again to pass legislation to simplify the PPP loan forgiveness for small businesses that have been hit the hardest?
Well, thank you. The health insurance tax was a great bipartisan effort. I partnered with Cory Gardner from Colorado. The two of us led the legislation, and then we worked with leadership on both sides of the aisle to try and have the repeal included in the appropriations package that passed last December. So it was very exciting to see it finally get done. You know, I hope that we are going to get a forgiveness form proposal from the Department of Treasury and SBA that will be simplified much more than what I have seen to date. It's getting better. But I know we're still hearing from a lot of small businesses that they're very concerned about what is expected in order to get those loans forgiven. What I am hopeful will happen as we get back to Washington and begin to negotiate again is that we will be able to agree on another round of the PPP program. And we are very close. Democrats and Republicans, the four of us, as I said, who negotiated that original package, have been talking back and forth. We sort of put those discussions on hold because of the failure to get a broader agreement. But I think we're very close and we'll be able to come to some agreement on additional help for small businesses if we're able to get a larger package that moves. And let me just introduce some of the people who are on the call. Ashley mentioned them. Robert Henson, who is my staff person who works with the Small Business Committee. He's the expert in all things PPP and other issues related to small business. So he is a really good resource. In New Hampshire, that role is filled by Michelle Cota, who is also on the call today. And I know many of you know her or you get her emails as she tries to keep everybody informed about what's happening in Washington. Also on the call is Ariel Marshall, who is my legislative director, who's the person in Washington who works on the legislation. And here with me in New Hampshire is Sarah Holmes, who's my state director. So hopefully between us, we can respond to all of the questions that you have.
Thank you, Senator. Donna, did you have a question?
Okay, I just wanted to type in the chat those names of the senator's staff so that people, if they want to ask directly, they can do to those four people mentioned. So thank you again for being here, Senator. Ashley and I did pool both our memberships prior to this conversation. So in addition to the chat, we do have some prepared questions, and there were several themes that we constructed into some questions. So according to a recent NHPR story, hundreds of New Hampshire businesses had to close as a result of COVID-19, and many of those permanently. So while businesses work to find a safe way and different safe ways to open, is Congress looking at providing any liability protections for businesses who are doing everything they can to implement safe practices in alignment with CDC recommendations and to keep their employees and their customers safe? Yeah. It's all about liability.
It is. I appreciate that it's a very big issue. It reminds me of post 9/11 when thinking about how to deal with liability around terrorism was an issue. The Republican proposal that was introduced by Mitch McConnell included a big list of liability provisions that I think were broader than are going to get passed. I do think there is a compromise point where we ought to be able to pass some limited liability provisions that apply to those businesses who are following the guidelines from the CDC or the state or whatever. One of the issues that complicates this is that so many of the guidelines have not been consistent, I think is the best way to put it. I met yesterday with a group of folks who have entertainment venues who have been affected, as you all know, pretty dramatically because they were some of the first, like restaurants and hotels, to be shut down, and they still can't open really in a way that allows them to make money because of the limitations on audiences. So that was one of the concerns that they raised with me. They were concerned about liability, but they were also concerned about the changing guidelines that they've gotten from the state that have been issued at the CDC level, and they're not sure what they should be following. So I do think that makes it challenging as we're thinking about complying in a way that would allow you to be included with those liability provisions. But having said that, I do think there's a place that we ought to be able to reach agreement, and it's my hope that we will do that. I know that my colleagues on the Republican side don't want to pass any legislation that doesn't include liability provisions, so I think we're going to be able to come to some agreement, I hope, in order to get that done.
Thank you. Ashley, you're next.
Thank you. And Senator, I did want to highlight a question we received through the chat. I know that several of our nonprofits have been continuing to service the community during this time. And from nonprofits and some corporate businesses alike, we've heard the question, wondering, they've said that the PPP earlier on in the shutdown was life-saving for them, and wondering if there's any planning going on in Congress right now for a potential additional round of aid if we needed to see another shutdown of business as the weather turns.
Well, I'm hopeful that we can get another round, whether there's another shutdown or not, because as you're hearing from your members, and as I've heard as I've traveled around the state, we still have a lot of businesses that are hurting, that need continued help if they're going to make it through the year. The PPP program officially ended August 8th, so we have about over $120 billion still left from the funding that was allocated for that program. Again, we've been working on the Democratic side, and our Republican colleagues have been working on the Small Business Committee on the Republican side to come up with proposals that we think will help with another round of PPP that might include, that's targeted to, depending on the proposal, that's targeted to smaller businesses, so with fewer than 500 employees. Also looking at the Republican proposal has some longer term help for small businesses that are similar to the 7A loan program. So looking at what else we can do to be creative and try and help those businesses that still need help.
Great, thank you. So a little bit back to COVID-19, and let's talk about masks. I'm hearing from many of our businesses, and I'm sure Ashley is as well, that they're frustrated to have to enforce mask requirements required by guidelines that are put in place to allow them to operate. And, there's times when it gets pretty unpleasant between customers and even among employees. It can be easier for business owners to enforce mask requirements when they can point to a order of government, an order from the government, specifically requiring a face covering. And we're currently seeing a lot of that happening in New Hampshire municipalities and in various states that surround New Hampshire. Does the federal government have the ability, authority, or any plans to implement any type of mask or statewide, or I guess nationwide safety requirements?
Well, the president has the authority to implement a mask mandate under public health emergency law. Obviously, to date, he has not been interested in doing that. I think, and New Hampshire, as we all know, is the only state in New England that has not issued a mask mandate. I think it's important. The scientific evidence tells us that wearing a mask can save lives. And I think it's important to help people recognize what the science says and to get this out of being a partisan issue. This shouldn't be a partisan issue. This should be about what the scientific evidence has to say about how we save lives and protect people. And I would hope that that's what we would do. As you point out, there are a number of communities in New Hampshire that have already mandated mask wearing. Whenever I go out and am in a group and I'm not outside exercising or doing something, I'm wearing a mask because it's good health practice. And I would hope that we can help people understand that. The challenge with mandates is that you have to enforce them. And I think most people don't. It's the challenge that your small businesses are having. You know, to have police fining people for not wearing a mask is probably not the best use of our law enforcement resources. But helping to educate people, having public officials who are following best practices, who are wearing masks, who talk about why it's important, it seems to me that that's one of the best things we can do. And as I have talked to school officials, they're all talking about bringing students back in. At least the school officials that I have talked to who are bringing kids back are bringing kids back who are wearing masks. Because they understand that that's what the scientific evidence says we should be doing to respond to this pandemic.
Thank you, Senator. And again, we had referenced the repealing of the health insurance tax earlier, which I know had the potential to cost businesses thousands in additional taxes a year. What else can Congress do to reduce the healthcare costs for individuals as well as small businesses?
Well, I believe we need to not just preserve the Affordable Care Act, which has allowed about 100,000 people in New Hampshire to get health care coverage, either through the health insurance that's available under the Affordable Care Act or through the expansion of Medicaid. Right now, there is a lawsuit that is joined by the Department of Justice and the Trump administration to try and overturn the Affordable Care Act. And if that happens, there is nothing currently being proposed to replace it. I think that's problematic for so many people, for people with pre-existing conditions who need health insurance. Having that law overturned creates a real limbo situation for so many, really, literally millions of people in this country. So I think there are ways that we should be improving on the Affordable Care Act and addressing healthcare costs. One of the most important ways is to address prescription drug costs. That's one of the biggest drivers in the costs of healthcare. And there are a number of things that we could do that are not huge disruptions to the system. For example, we should allow the Centers for Medicare and Medicaid to negotiate for drug prices with the pharmaceutical companies. That's what the VA does. If there are any veterans on this Zoom, you know how much cheaper it is to get your prescription drugs through the VA than it is to get them on the market. And that's because CMS does not negotiate with the pharmaceutical companies. They just take the pricing that they're given. We also need to look at the reimportation of safe drugs from Canada and other countries where if you've ever bought insulin in the United States and compare that to the cost of insulin in Canada or Mexico, for that matter, it is significantly cheaper. So looking at, those are just a couple of ways, allowing generic drugs to come on the market faster. All of those ways would help in lowering healthcare costs because they would lower prescription drug costs.
Well, Senator, along the lines talking about health and healthcare, the expansion of telemedicine has improved access to care and made giving and receiving care much more efficient and cost-effective for patients and healthcare providers. This is especially true for mental health, and given that we're in a pandemic and people were, shuffled away for months in isolation, can you discuss what Congress is doing to make sure the access to mental telehealth remains as it is now? Even after we've emerged out after the pandemic. So where are we going with telehealth in general and then telehealth specific to mental health?
Well, Donna, I think you're absolutely right. This is one of the few good news stories to come out of the pandemic, is the role that telehealth can play in our healthcare system. Last Thursday, I was up at Dartmouth Hitchcock Hospital, and I got a demonstration of the telehealth that they are doing to back up 8 hospitals in their system for emergency room care. And it was fascinating to watch in real time those the doctors, many of whom had skills that were not available in some of the smaller hospitals, able to back up emergency room care for people coming in. So it goes to one of the real benefits of telehealth. And as you point out, mental health also has benefited. And as we look at the impacts of this pandemic, we know that mental health concerns have increased during the pandemic as people have felt isolated, and anxiety has increased, and people are worried about paying their bills and taking care of their families. So it's one of the needs we're going to continue to have. We need to continue the reimbursement rates to make sure that they're comparable between telehealth and in-person visits. We need to continue the relaxing of some of the waivers that have been issued to allow people to be seen in their homes as opposed to going to a particular location to meet with a doctor or to do telehealth from a particular location. We also need to do audio health, as it's less apparent in the southern part of the state, but we have significant portions of northern New Hampshire, some in western New Hampshire, where not only do people not have access to high-speed internet, but they also don't actually have computers. And so making sure that they can get healthcare through the telephone is also important. And working with some of my bipartisan colleagues, we were able to get an expansion of that telehealth coverage to audio health as well. And that needs to continue. And I'm hopeful, based on my conversations with people, that there's a lot of bipartisan support to do this, because we are recognizing that we can not only be just as effective in many cases, but in some even more effective, because we can reach people who might not be able to travel to a doctor's office or to an emergency room to get care. And for a lot of people who may need mental health care, we have a limited number of providers, and it's another way to try and get out and reach out to those people who need assistance.
Thank you, Senator. Shifting off of healthcare for a moment, New Hampshire restaurants, along with several other industries like you mentioned, have been able to operate by evolving, offering outdoor seating, and being able to expand their business model. However, many of them have struggled with employees returning to work due to the expanded unemployment benefits. So with the colder weather approaching, do you know if Congress has any plans on a way to help people individually without making it a disincentive to return to work?
Yeah, it's one of the areas that is under negotiation, as I'm sure you've seen, and is continuing to be a sticking point, is how much assistance to provide to people who are out of work. When I said I was at that meeting yesterday with people with entertainment venues, there were several entertainers there, and they were also talking about the fact that we've got a lot of people who have been laid off, who are lighting technicians and stage managers and have other roles in some of those venues. And without that expanded unemployment, many of those people would not have been able to stay in New Hampshire. So I've heard from industries on both sides of that issue. And I think what's important is that, as our state system is designed to do, that if people are able to go back to work, then they're not supposed to be able to collect unemployment. So we need to ensure that those provisions in the unemployment law are followed. But we also need to continue to provide help to people who may not be able to go back to work for whatever reason, and try and do it in a way that allows continued assistance without keeping people out of the job market.
So, Senator, next, we've heard a lot about testing, and many of the guidelines issued to allow businesses to operate point to employees having negative COVID tests. So, but often the results take days to come back, and colleges, professional sports teams, and others have been able to get quick results and even access to like rapid test machines. Can you tell us where we're at on federal efforts to make more rapid testing machines available widely so that businesses can reopen in comfort knowing their employees are COVID free?
Well, you're right. It's one of the most important things we can do as we try and figure out how we continue to live with the coronavirus before we get a vaccine. Frequent testing, being able to do contact tracing so we know who someone who tests positive has come in contact with, and we can isolate that, identify hotspots, shut those down, and not have to shut down the economy or the community as a whole. That's the goal. And in order to do that, we need those rapid tests. There has been one approved and there are some rapid testing machines that are out there. The state of New Hampshire has gotten, I think, maybe 25 that the state received recently, but we need many more than that. And we need to be able to, as I said, when I was up at Dartmouth-Hitchcock, they were talking about some of their efforts to research and help with the coronavirus. And one of the things that they pointed out is that what we really need is an in-home test that everyone can do before leaving our house so that we know when we go out, we're safe, and we know that others have those tests, so they're going to be safe as well. So there is no doubt that in order to get back to more of a semblance of normal, we need more tests. It's actually one of the issues that is a sticking point in negotiations as we're looking at additional help for states and municipalities and for everyone, that there's a disagreement over how much help should be provided for continued testing and contact tracing. So I think it's very important that we're not going to get where we need to be until we have that, and we need to put more resources into that at the federal level. It's one of the reasons why invoking the Defense Production Act made so much sense, and I'm disappointed that we haven't really done that in any way that's robust.
Thank you, Senator. I think another one of the challenges that has become apparent in New Hampshire throughout the pandemic is the struggles with transportation and the direct impact that either better transportation has on economic growth and then vice versa, with limited infrastructure improvements kind of harboring that growth. So can you share the update of any transportation funding in Congress?
Yeah, I wish I had better news on this. Last fall, the Environment and Public Works Committee in the Senate passed out the highway bill, which include $287 billion more than the FAST Act, which is the legislation that has been in place, which would extend over 5 years. And it's pretty much been stalled since then. It still needs to go through a number of other committees in the Senate. The House included significant funding for transportation in the HEROES Act that they passed back in May in response to the coronavirus. And I'm hopeful that if we can get a package, that it would include some additional help for transportation. I really think that once we get through this pandemic, we need a major investment in infrastructure in this country. That should include not just highways, roads and bridges, but water systems, sewer systems, high-speed internet, broadband. We need to get broadband to every household in America. So there is a lot that we still need to do, and I'm hopeful that we can come to some agreement to make that kind of an investment, because if we don't, we are falling behind the other major industrialized countries.
Yeah, that's good feedback about the broadband too, because we're finding that it's not just about business anymore. You need high-speed internet. Kids everyone's homeschooling, and you need that type of access in order to provide for people. So that would be great. Federal support for that everywhere. So another question that we had, both chambers have a pretty significant member population that's made up of nonprofits. And with so much economic uncertainty and people being out of work, charitable giving's been down, and many of the nonprofits are suffering from that. So what is Congress doing to help nonprofits who are also struggling during this pandemic?
Well, it's one of the reasons I argued that the PPP program should cover not just small businesses, but nonprofits that fit that criteria. And so we've had a number of nonprofits in New Hampshire that have benefited from that program. And again, if we're able to get a second round, I think there are a number that will continue to benefit. But one of the things that happened as the result of the tax bill that passed in 2017 was a change in the tax law and on charitable deductions. A number of us have, on both sides of the aisle, have been concerned about that and what we can do to try and incentivize charitable deductions, particularly right now when we know how important it is to those nonprofits. And those nonprofits, as you all know so well, provide so many services and help to New Hampshire residents in many different ways. So helping them is very important. So we have proposed a before taxes deduction of up to $4,000 per individual. So it would be $8,000 per couple on the tax form. Again, there are 6 co-sponsors of this legislation, 3 Democrats and 3 Republicans. I'm hopeful that we will be able to get that included in any package because it does have that bipartisan support.
Thank you, Senator. One of the other things that we've heard from members across both chambers is a concern about the impact on the unemployment insurance tax rates, property taxes, other essential services, typically paid for through those funds, and being afraid that taxpayers are going to have to subsidize any state or local budget deficits that might come about due to the pandemic. Is there a way for the federal government to provide some support to those budgets and to fill those holes as we move forward?
Well, that's why I've been arguing, as have many of my colleagues, for help for state and local governments. Now, one of the challenges with the CARES Act that passed back in March was that there was a limit on what those dollars could be used for. So it was very specific about saying it could not be used to address budget deficits. There has been, and there was a time limit on that. Now, one of the positive aspects of both the Democratic package from the House and the Republican Senate package has been that they are more flexible with allowing those dollars to be used past December 31st of this year. So I think that's helpful and a little more flexible on how those dollars can be used. But the reality is it has been the states and local governments that have been on the front lines of responding to this pandemic. Anything that, as I've talked to mayors around the state, they talk about the concerns they have if they don't get some additional help because they see revenues came in pretty well earlier in the year, but they're worried about what happens at the end of the year as people are affected by the pandemic. And that will be reflected in revenue collection. We're seeing at the state level where the state has got a budget deficit of over $500 million. So I think it's important for us to provide some assistance to state and local governments that can be used to help them address this pandemic. And if they're taking money from, the police department and using that to respond to people who are affected by the coronavirus, then we ought to be able to help them put that money back into the police department because it helps them maintain the services and respond to the pandemic. So it's one of the biggest sticking points that we've seen in the negotiations in the Senate. Majority Leader McConnell said back in June that he thought states and municipalities ought to be able to go bankrupt. I don't think that's the kind of response that we really ought to have. I think we ought to be trying to help states and municipalities. And as I said, New Hampshire got $1.25 billion because we were able to get help for state and cities. And we've had additional help in a number of other programs for communities in New Hampshire. So I think it's something that's very important as we look at how do we keep our communities afloat during this difficult time.
Well, Senator, I'm going to just use this stage while you're kind of talking about that, and Ashley might want to chime in too, to talk a little bit about assistance to 501c6s, which are chambers of commerce and business groups. And you were talking about that there were some, rules put on how the money can and cannot be spent at the federal level. And I think you were one of the ones that was trying to include 501c6s and PPP. We were not included to that. And those
Right.
who don't know out there that are listening, Chamber is a nonprofit with a business organization, but there's other ones too. There's the Automobile Dealers Associations, there's the Restaurant and Lodging Associations. We're the nonprofits that are actually designed to support the small businesses that are being impacted by the coronavirus and in the current economic downturn. So it has been a struggle, and it took a while, and finally it was okay, we have some money at the state level earmarked for C6s, but because of the federal guidelines, it's not just a grant. The chambers are having to construct certain programs in order to receive those funds to the state. The state has been good and trying to thread the needle so that we are able to access those funds. But it's beyond just chambers, and I just wonder if you want to comment on the issue with 501c6s, because Ashley, you want to chime in? We've been working really hard trying to, I keep telling people, we're trying to put on our face mask, and you're supposed to put on your face mask before you help the other people. We've been helping the other people, and now we are 501c6s out there need some assistance as well. Ashley, do you have comments on this as well?
I think we've been going through a similar situation of knowing what we're doing tomorrow, but not necessarily knowing what a month from now looks like. That's a good way to put it, Ashley. I think there's a lot of truth in that.
Yeah. So what can you do for C6s, and what are you doing for C6s, I hope?
Well, again, it was a debate we had at the time. One of the challenges is that C6s include a broad array of organizations. So it's not just chambers, as you point out, and it's not just organizations that are affiliated with a particular industry. It's also things like the National Football Association. So one of the discussions that we're having is, how do we provide the assistance to those organizations that really need the assistance? And I would argue with you that chambers are in that category, because you're going to help small businesses get through this. That's what we're trying to do in my office. That's what you all are trying to do. And the more we can provide assistance to those people who are trying to help, the better. The package that passed the House in May, the HEROES Act, expands the PPP program, so it would include C6s as well as a number of other incorporated organizations. It doesn't provide any additional money, however, but it does expand the program to include folks like chambers. The proposal that's been introduced in the Senate to date does not do that, but I'm hopeful that as we're negotiating, this is one area that we can provide some assistance to, because as I said, I think we ought to be looking to, how do we provide long-term help for people? How do we help businesses get back on their feet? How do we help those people who may have lost their jobs? Not just in the short term, but what can we put in place that will help longer term to get the economy moving again? And that's one of those things that I think does that.
Thank you.
Thank you, Senator. And we are getting close to the end of our time. So I did want to have one last question, returning to the topic around the incredible bipartisan effort it took to repeal the health insurance tax. Are there any takeaways from eliminating that tax that would be pertinent to solving the stalemates on the COVID relief or other important issues that are sitting on someone's desk at the moment?
Boy, Ashley, I think you've hit the nail on the head. The fact is that we were successful back in the early days of COVID because people worked together and recognized the mutual goals and compromised in order to get something that was beneficial to the majority of people. That's what we need to do again. That bipartisan effort one of the things we did in the Senate was to assign people to work on particular aspects of the proposal. That's why I was working with Senators Rubio and Collins and Cardin, the four of us from the Small Business Committee, to try and address how could we help small businesses. We need to do that again. We need to put aside our differences. We need to get busy and we need to get something done because the people of New Hampshire and the people of this country demand it and deserve it. And it's part of our responsibility to work together. So that's what I'm going to be focused on. And I'm hopeful that we will take a lesson from some of the successes that we've had. One big success, by the way, that we had when we went back to Washington in May was the passage of the Land and Water Conservation Fund, permanently funded, and additional support as part of that for national parks and wildlife areas. It's called the Great American Outdoors Act. And you all know that in New Hampshire, we benefit greatly from the outdoor economy. It's a huge contributor to our economy, both in terms of jobs and our tourism industry and people coming into the state. So that was a big win, and it was bipartisan. People work together to get that done. That's how we should be making decisions in Washington and should be able to get things done.
Excellent. So that kind of wraps up the Q&A portion of today's event. I thank you very much for being here, Senator. We'd like to invite you now to offer some of your closing remarks and take it away.
Well, again, thanks very much, Donna and Ashley, for everything that you're doing and for giving me the opportunity to talk with your members today. I appreciate all of the time that people have put in to both ask questions and to be part of this conversation. I am here with all of my staff so that we can answer your questions and so that we can try and be of assistance if there are particular challenges that you're facing. We know that the hardships resulting from the coronavirus have hit so many people in so many ways in New Hampshire. And the most important thing I think we can do to get our economy up and running again is to address the coronavirus, to get the money for testing, get those rapid tests done, get the contact tracing done, continue to make sure that we get on top of the pandemic, because that's when people are going to feel comfortable going back into a restaurant at 100%. That's when they're going to feel comfortable with going to the movie theater, going into stores, when we're going to be happy to have our kids back in school. So I think that's the number one challenge that we have. And again, I'm going to do everything I can to try and make sure that there are resources to address the coronavirus and see if we can't support the research to get a vaccine, support additional testing and contact tracing, and help for hospitals and healthcare providers who continue to be at a disadvantage because of the financial impact of the virus on their businesses.
Thank you, Senator. And so thank you to everybody that joined us today. A brief reminder, both the Greater Derry Londonderry Chamber of Commerce and the Greater Salem Chamber of Commerce will be providing the link to the recording from today for anybody that would like to be able to go back or share it with others that you know in the area. And also a special thank you to Salem Community Television and Derry Community Access Media for both also providing this content out to their followers as well. Thank you again, Senator, for your time. Donna, did you have anything?
No, I just reiterate thank you to everyone. We're going to get through this, and everyone stay safe and healthy and happy, and let's just all have a little patience with each other and shop local.
Absolutely.
Thank you, everyone.
Thank you all.